Hi friends, so we are about to do genioplasty with jaw sculpting and angle osteoplasty for this handsome guy. So I'm going to explain what we're going to do in very few words. First of all, if you look at his face, his lower third is really less and this is come outside and this is short and retruded. So what are the main issues with this kind of a face sheath? The first thing is people tend to have issues with breathing and also people tend to have issues with sleeping, apart from aesthetics, that is. So when we are doing this kind of a bony procedure to augment the chin by bringing the lower jaw forward along with the muscles attached to it, we also move the attachment of the tongue, we move the attachment of the hyoid bone, all of that, the entire complex moves forward and downwards, thereby improving, thereby increasing the airway which we have behind. Airway is a space that we need for breathing and also sleeping. So this is two essential functions that we can interfere, without which patients like him can develop hypertension in the future and various issues with the future with relation to both sleep patterns and breathing issues. So this is absolutely warranted to sort this out. This is the best way to cure it, and it also has a great impact aesthetically. What are the other options that he has? He can put a chin implant, but that's going to do nothing for his breathing. That's going to do nothing for his sleeping. So this procedure that we're suggesting that we're going to do for him is a bony osseous procedure that brings the bone and the attached muscles forwards and downwards. In this particular patient, we've planned and we've calculated that to be 14 millimeters and 7 millimeters. We're also going to change the angle here. That's to give him an angle that is straight, so that when you look from the side, he has a nice profile. So there is a touch of aesthetics to this as well. But even though there is an aesthetic component, I would definitely think that this is so much more functional than aesthetic. Thank you.
Very difficult. Chair. Ventilate.
Aka tube apappo paathukonom.
Jala. Kappun.
This is genioplasty, jaw sculpting and angle osteoplasty procedure for this man who has a very small and short, somewhat a stubby chin, a very evident double chin as well. That's
for this patient is we work on the entire lower third of the face. So lower third of the face essentially starts from where the upper teeth stops. So we've increased this height by 7 millimeters. We've increased this height by 14 millimeters here. And then we've taken this angle inside. There's a lot of edema, but we've given him a much better angle right now. And that's the shape he's going to get. More normal, natural looking angle of about 115, 120 degrees. Similar thing of this side, there's a lot of edema because we've worked on the muscle as well. It's going to take a few weeks to subside and to go in and to give it a nice jawline. We're going to show you how he looked before. So you can see this part, how much of improvement we've achieved. So he had a short stubby chin and his face was squarish. So this in one word can be called as correction of a short square face into a longer, more ovoid face form. So we can show the side view maybe. Yeah, I can show that. So you can see the side view. This chin was hardly there. So this has come forward by 14 millimeters in this direction. And I said we've taken it down by 7 millimeters. Yeah, 7 millimeters is not a great. He needed more, but that's the maximum we could do in one go without bone grafting. That's what we've done. Also done work here on the angle. So I said he had a short square face like this. So now we've made it angular. And we've also made it much more longer in the anterior region. Today we'll take it off. Once we take it off, we'll have some more comfort. Today, even if possible till tomorrow evening, go for liquid diet. And then after that, we'll see how we can switch you to some soft solid diet. And there's a lot of swelling here. There's not so much swelling here. Obviously, because this is a bone part. There, the work has been on bone. But on top of the bone, there's a thick masseter and soft tissue and fat and everything. So that has to attach and go inside. Will take some time. Okay? Right. ரொம்ப ட்ரை பண்ணாதீங்க.
அதான் இதனாலயான்னு தெரியல.
இதனால தான் பரவ வேற என்ன?
இந்த கே இது இருக்கு இல்லையா? அதனால
மசில்ஸ் எல்லாம் டிட்டாச் பண்ணி கட் பண்ணிருந்த மசில் அதனால தான்.
ஸோ சாப்பிடும்போது கூட சாப்பிடவே முடியலங்கிற மாதிரி இல்லை.
பட் ஹார்ட் டயட் சாப்பிட வேண்டாம் நீங்கள். ஹார்ட் டயட்லாம் லிக்விட்லேயே போகட்டும்.
ஐ மீன் கொஞ்சம் அந்த இட்லி வந்து சாப்பிட்றேன். இட்லி
ஸ்மாஷ் பண்ண திங்ஸ் ஓகே. அதுவும் ரொம்ப சூ பண்ணாமல் ஸ்வாலோயிங் தான் நமக்கு இம்பார்ட்டண்ட்.
சூ எப்போலேருந்து பண்ண ஆரம்பிக்கலாம்?
இன்னொரு ஒரு வாரம் போட்டோம்.
ஓகே, கொஞ்சம் கொஞ்சமாக லைட்டாக.
ஆமாம், இன்னைக்கு கிளம்புறீங்களா? அப்போ சோக்கெல்லாம் பண்ணி வைக்கல? இட்ஸ் ட்ரை நவ். I soaked. It's gone. Almost fully dry. We got to soak him again. Okay.
Hello everyone. We will do a follow-up for a patient post a jaw surgery. His has been only a lower jaw surgery. Genioplasty, jaw sculpting and an angle osteoplasty has been done. We'll go on to explain as to what problems he had with the lower third of the face. Proceed with this Genioplasty removal, the most tricky part. I need a little more sterilium system. Okay, we have soaked it up already. Just bear a little bit with us, huh? Okay, this part won't hurt much. It's removing the lower part, huh? Okay. Bearable? Okay, I think the soaking has worked well for you. This part will hurt a little bit. Okay, this will be easy. You want me to wait? For you, the good thing is breathe normally, don't worry. Proceed. It's completely soaked. It's dripping of sterilium. Look little up. Yeah. Look up.
Wait, this is finding more inside.
Okay. Just look a little up. Okay, done. We'll do a little bit of cleaning. And then we'll see his pre-operative pictures. Okay. You can hold this in your left hand and just have a look at yourself. The first view that I will show you will be the side view because maximum changes will be visible. Look to one side, see your left. Okay. So this is how he looked before. He had a classical case of a very short and small. I used short because the vertical length was insufficient. I used small because the horizontal length was insufficient. He had a face which had no defined angle of the mandible. His lower border of the face was not defined. We have shaped this inward now. It will have a defined chisel lower border. We have advanced the chin now. So now chin has moved ahead. The lower border has been contoured and the chin is giving a sufficient height as well as a projection to the lower third of the face. Yeah. Now come to the frontal view. You can look straight. I will tell you what difficulties or what problems you had before. If I divide your face into 3 halves, this will form the upper third, the middle third. The lower third, starting from the base of the nose to your chin, was very small compared to the rest of the proportion of the face. You already have a small face, but this was quite small. The chin was short and small. Now what we have got is, we have got the chin little down and forward as well. This will not only change your aesthetic appearance, that is the look, it will also change its functionality. The lower chin often causes problems like breathing difficulty. It makes the posterior pharyngeal airway space smaller. So he can also have snoring problems or breathing difficulty. That also takes care of these problems. His bite or occlusion has not been changed or played with. That's because it was not necessary. It was only with the angle of the mandible on both sides and the chin. We'll show other views as well. You can turn the right and also compare if you want. Yeah, able to see? If I draw a straight line, say starting from your forehead, I intersect your nose, I intersect your upper lip. But when it comes to your lower chin, it was receded, it was way behind. And you see this angle that's called between the lip and the chin, and you see how this angle is forming now. Also the angle with the lower border of the mandible, it has no definition. It was going way obtuse and there was no definition at all. Yes, with respect to the angle, there's swelling on both these sides. Entire swelling will come down. The swelling in the overall lower half of the face, but now you have at least a definition which is pointy and coming down. You can appreciate all the changes?
Yeah.
How does it look?
Yeah, it's fine. Compared to the previous.
Few instructions we'll give you will be with respect to healing. Complete healing will take time, around a month's time, 4 weeks for you. Intraoral care has to be taken, hygiene has to be maintained. We'll put you on tablets, all antibiotics, painkillers shall be given. Yeah, and thing which we seek from you is your photographs after some time, such that we can analyze after the swelling is subside. We'll take a scan for you and also tell you how the changes have been done, what millimeter exactly. Okay?
Sure.
Yeah? Okay. Thank you.